Hey guys, Cole Brenny here, founder of PracticingDentist.com, where I teach dentists to master their profession, learn the business of dentistry, and build practices that they love. So thanks for tuning in. Today I'm going to talk about a big frustration for almost all dentists, but especially new dentists, and that's getting behind schedule. So today I'm going to give you 6 tips to stay ahead of schedule, not get bogged down, and be profitable as a new dentist. Whether you're a new dentist just getting out of dental school or a dentist that's been practicing for 3 or 4 years, here's 6 tips to stay on time and stay efficient. So number 1 is root canal treatments. If you're scheduling an endo, I would recommend initially, if you're just getting into it, to talk to patients and recommend that the endo be completed in 2 appointments. So it's just how you word it. I would say, hey, Mr. So-and-so, today we're going to do your root canal on this tooth, and normally this takes 2 appointments. The first appointment is to really clean it well, and the second is to seal it. And then you give yourself the out. If by chance things go really well, the tooth lets us get inside and clean it easily, I'm going to seal this in 1 appointment. So give yourself the out for 2 appointments, just in case you get bogged down. But if you finish it in 1, you're a hero. Number 2, anesthesia. Anesthesia can be a big time killer, especially lower blocks. If you have 1 filling and you're waiting for your block, and that's all your profit for that, all your profit or production for that hour is 1 simple filling, and your block doesn't take after your first injection, and pretty soon you're 30 minutes behind waiting for your patient to get numb, twiddling your thumbs. That's a time killer, and it's not profitable. So what I'd recommend is get good at anesthesia, especially lower blocks. I'd recommend 2 carps of Lido, and then I do an infiltration, buccal lingual septicane. And if that doesn't get the tooth numb, some cases second molars, mandibular second molar is pretty difficult, then I use my Ligajet, do a PDL injection, and that usually takes care of it. So if you're doing a lower block, get them numb, don't mess around. Number 3 is anticipate problems. Surgery and endo, usually the most problematic for new dentists. You just don't have the experience to anticipate problems, and you don't know what to do when they happen. So be slow in those areas, work up, ramp up. Easy cases at first, ramp up to more difficult cases as you grow. Number 4, hygiene. Hygiene, you got to learn the dance. I get up every morning, look at my hygiene schedule, talk to my assistant, talk to my hygienist, have a meeting, put together a plan for when I think I'm going to be able to come in. Don't let your patients wait. That's just a practice killer. It's a patient experience killer. So be on time, do their exam on time. If you get bogged down by a big treatment plan, so you see a patient, there's something new, and they want to chat and ask you about all the options, sometimes what you need to do is tell them, hey, Mr. So-and-so, I'm going to call you tonight personally so we can review this, so we're not rushed, and I can give you a really comprehensive description of what needs to be done and answer any questions you have. So if you get bogged down by a big treatment plan discussion, what I would do is tell the patient you'll call them personally or have them back, reschedule them for another consult. Number 5, if you have a second chair, get great at utilizing 2 chairs. So have 1 chair for an overflow, coordinate with that with your assistant. She needs to be on the ball, know when to bring them back, take the x-ray so you can do what you need to do in your op and do your non-productive procedures in your other op. That's adjustments, emergency appointments where your assistant needs to take a PA, consults, things like that. Use that in the second chair, keep your production rolling in chair 1 so you can stay busy while your assistant is doing the busy work. And the last one, I want you guys to put difficult procedures, new procedures, especially endo surgery. If you're tackling something new, pushing yourself a little bit, put those at the end of the day. So put your more difficult procedures at the end of the day. That way, if you get really bogged down, things don't go well, at least you're not destroying your whole schedule for the whole day. You're just keeping your assistant late. They're not going to be happy, but honestly, you're going to be a lot less stressed. You can dictate to your patients too, for a more difficult procedure, tell them, hey, this is the time I use to schedule, just because then you're done for the day, take the rest of the day off, it's better for you, go home and rest. And if you just tell them that this is the time you have reserved, a lot of times they're open to that. So awesome, hopefully these help, guys. Stay tuned, practicingdentist.com. Check us out on Facebook, give us a like. If you're not a subscriber, sign up, and stay tuned because I'll have a lot of good teaching coming out every month. Thanks.